It happened in March, April, May, June, July, and August. For the past 6 months, over 100 people died of an overdose in BC. This past summer, seeing the highest number of overdose calls ever recorded in the province over a 3-month stretch, with close to 7,500 coming in.
We've now passed our 2019 year total in just 8 months of 2020.
147 illicit drug toxicity deaths have been announced in the month of August, a 71% increase over the number of deaths in August 2019. So far this year, there have been 1,068 illicit drug deaths. Compare that to 983 last year.
Why? Why can't we, implement stuff to actually support people to move them further and improve the quality of their lives?
Since the pandemic, the BC Coroner's Service says toxicity levels in the province's drug supply have tripled.
Normally we see something kind of 5 to 10% range, certainly in previous months. What we've seen since the start of the COVID-19 pandemic amidst the dual health emergency are numbers closer to 14-15%. So we know that the supply has become extremely toxic during the dual health emergency. We're still trying to dig into why that's happening and working with different partners to do that.
The latest overdose numbers were a major topic for discussion on the campaign trail for all 3 provincial candidates Wednesday.
The majority of the overdose deaths are youngish males dying alone in their home. We're going to have to address the issue of treating addictions by providing a pathway to get off drugs.
We need to decriminalize simple possession of narcotics. We don't want to make criminals, we want to help patients.
In a statement, Sonia First to Know, leader of the BC Greens, writes, there is clear provincial action that could be taken. Dr. Bonnie Henry has laid it out. So far, the NDP have chosen to ignore her advice and leave it to Ottawa. Experts continue to urge the public never to use alone and to download apps like the Lifeguard app, which will call for help if you become unresponsive while using. As toxicity levels are on the rise, the BC Coroner's Service is issuing further advice to those who use.
If you are using and you don't have the opportunity to test your drugs, make sure that you're introducing the supply slower into your system, because with that extreme toxicity, it's going to hit you a lot harder.
In New Westminster, Ashley Burr, City News.